Hi friends, welcome to Diagnox. We have been discussing on many pathologies, implants, etc. in the previous videos. One of the most frequently asked questions is the normal landmarks. So we have traced the normal landmarks in IUP radiograph as well as a panoramic radiograph. We would just see how the normal landmarks appears in a cone beam CT scan. I would be showing you now the normal anatomical landmarks in maxilla. So this is the 3D image of a patient. So we would move on to the MPR slices. MPR stands for multiplanar reformation. It is a process of creating 2D images in the coronal sagittal oblique planes using cone beam CT scan. So first we would trace the normal landmarks in maxilla. So one of the most important landmark in anterior maxilla is incisive foramen. So now I would be positioning the cursor in the incisive foramen so that the incisive foramen appears in all the planes. You can see the incisive foramen in the coronal plane, in the sagittal plane as well as in the axial plane. Incisive canal is also called as nasopalatine canal. It has got important functions when it comes to implantology. We should be very careful not to violate the incisive canal. So another important aspect of incisive canal is that it has got an inherent tendency to transform into incisive canal cyst. So now we would go up and down through the entire course of the incisive canal. I will be measuring the size of the incisive canal using this particular measuring tool. So now you can see that this incisive canal measures about 2.7 mm in diameter, which is absolutely normal. A normal incisive canal ranges less than 6 mm. When the incisive canal is of size more than 6 mm, we can suspect an cyst called as incisive canal cyst. Usually in IUP radiograph, incisive canal is seen as a heart-shaped radiolucency because of the projection of anterior nasal spine, which is seen here at the floor of nasal cavity on the superior aspect of incisive canal. So another important landmark in anterior maxilla is the floor of nasal cavity, which can be clearly appreciated in coronal scans. You can appreciate the incisive canal, you can appreciate the floor of nasal cavity. This particular floor comes to importance while doing implant planning. When it comes to anterior maxilla, one common landmark we see in IUP radiograph is the incisive fossa. Incisive fossa is nothing but it is a depressed area of bone surrounding the centrals and laterals, which is seen as a radiolucent area in IUP radiograph. So I would move on through the 3D view to show the incisive fossa. This is the region where there is less bone, which can be seen in IUP as a relative radiolucent area. So these are the important landmarks in anterior maxilla. That is, you have an incisive canal, you have the incisive fossa, you have anterior nasal spine, you have the floor of the nasal cavity. And moving on to the posterior region, the most important landmark is the floor of maxillary sinus. You have two maxillary sinus, one is right, one is left, and you can appreciate the shape of the maxillary sinus, roughly pyramidal in shape. This is the medial wall of maxillary sinus, this is the facial wall of maxillary sinus, and this is the posterior wall of maxillary sinus. The medial wall of maxillary sinus forms the lateral wall of nasal cavity. So this is the nasal septum, which divides the nose into two halves, and you can see the nasal airway being obliterated on the right side compared to the left side. We can see another interesting finding, that is septae. You all know that septae are bony compartments that divide the maxillary sinus into few zones, and you can see multiple septae in this particular right sinus. You can see an incomplete septae in the left maxillary sinus. There are also other variations within the sinus like bony nodules, you have androliths, etc., which is not the case in this particular patient. And you can see minimal mucosal thickening surrounding the walls of right maxillary sinus. We would also move to the other views to appreciate the septae and the maxillary sinus. And you can see in this particular view, that's the sagittal view, you can see that incomplete septae here. You can see the thickening of floor of maxillary sinus. You can see the close relationship of molar roots to the maxillary sinus. So this is about maxillary sinus. And in IOP radiograph, we see an important finding, that is the Y line of Ennis, which is the area where the posterior wall of nasal floor and the anterior wall of maxillary sinus meet. So you can see this particular region where the posterior wall of nasal cavity and the anterior wall of maxillary sinus meet forms an inverted Y-shaped appearance, which is seen in IOP as an inverted Y in the canine region. It is called as Y line of Ennis. Now we will see anatomical landmarks on the posterior aspect of maxilla. So in the posterior aspect, you have maxillary tuberosity. This is the tuberosity. We have to go through all the slices to appreciate the tuberosity from the axial view, and this is tuberosity from the coronal view. This is from the sagittal view, where you can see the tuberosity, which is seen in a way similar to IOP radiograph. And distal to tuberosity, you have something called as pterygoid plates, and you can appreciate pterygoid plates very clearly from the axial slice. This is the lateral pterygoid plate, this is the medial pterygoid plate, and extending from medial pterygoid plate is the pterygoid hamulus. Another interesting landmark is the zygomatic buttress and zygomatic arch when it comes to maxilla, and this particular region is the zygomatic buttress region. And from these coronal slices, you can also appreciate the nasal cavity as well as maxillary sinus.